Welcome back to Addictopedia, the channel where we break down the complex world of addiction and recovery in a way that's clear, professional, and easy to understand. Today's topic is crucial because it answers one of the most common questions people have. How is addiction diagnosed? You may have heard of drug tests, rehab check-ins, or even psychological evaluations. But what does an actual diagnosis look like? And what criteria do professionals use to say, this is addiction? Let's dive deep. Before we get into the how, let's talk about why diagnosis is so important. Addiction, also called substance use disorder, is not just about using drugs or alcohol. It's about how that use affects your brain, your behavior, and your ability to function in daily life. Without a clear diagnosis, treatment becomes guesswork. A proper evaluation helps healthcare providers determine the severity of the addiction, the type of treatment needed, and whether other mental health conditions, like depression or anxiety, are involved. Think of it like diagnosing diabetes or heart disease. You wouldn't just look at symptoms, you'd run tests, take medical history, and use standard criteria. Addiction is no different. So, how do professionals diagnose addiction? It usually involves several steps. 1. Clinical evaluation. A psychiatrist, psychologist, or licensed drug and alcohol counselor will sit down with the person and go through their history. They'll ask questions like, how often do you use the substance? Have you tried cutting back before? How has your use affected work, school, relationships, or health? This is a conversation, not an interrogation. The goal is to understand patterns of use. 2. Lab tests. Blood, urine, or hair tests can show if someone has drugs or alcohol in their system. But here's the important part. These tests alone cannot diagnose addiction. For example, if someone has marijuana in their system, that only shows recent use, not whether it's a disorder. These tests are mostly used for monitoring treatment or ensuring compliance, not for diagnosis itself. 3. DSM-5 criteria. The gold standard for diagnosing addiction comes from the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5. Mental health professionals use it worldwide to classify disorders, including substance use disorders. The DSM-5 lists 11 key criteria, like using more than intended unsuccessful attempts to cut down, spending a lot of time getting, using, or recovering from the substance cravings and urges, neglecting responsibilities at work, school, or home, continuing use despite problems in relationships, giving up important activities, using even when it's physically dangerous, continuing despite physical or psychological harm, tolerance, needing more for the same effect, withdrawal symptoms when not using. If someone meets 2 to 3 of these criteria, it's considered a mild disorder. 4 to 5 criteria equals a moderate disorder, and 6 or more is classified as severe. This structured approach takes the guesswork out of diagnosis. Let's put this into an example. Imagine a 25-year-old man named Alex. He started drinking casually with friends in college. Over time, he began drinking every night. When asked, Alex admits he tried to cut down, but couldn't miss work repeatedly because of hangovers, fights with his partner about his drinking, feels strong cravings when he tries to stop. Based on DSM-5, Alex would meet multiple criteria: loss of control, neglecting responsibilities, relationship problems, and cravings. Depending on how many apply, he might be diagnosed with a moderate to severe alcohol use disorder. This diagnosis would then guide his treatment plan, which could include therapy, support groups, and possibly medication. It's also important to know that addiction often doesn't come alone. Many people with substance use disorders also struggle with depression, anxiety, PTSD, or ADHD. This is called a dual diagnosis. That's why mental health evaluations are critical. Treating only the addiction without addressing the underlying mental health condition often leads to relapse. Getting diagnosed with addiction can feel scary, but it's actually the first step toward healing. Think of it this way. A diagnosis is not a label. It's a roadmap. It tells you where you are and how to get where you want to be. With the right diagnosis, a person can access the right treatments, whether that's detox, inpatient rehab, outpatient therapy, or support groups like AA or Smart Recovery. To sum it up, addiction is diagnosed through a combination of clinical evaluation, lab tests for monitoring, and DSM-5 criteria. It's not about passing or failing a test. It's about understanding your relationship with substances and how they impact your life. Thanks for watching Addictopedia. If you found this video helpful, don't forget to like, share, and subscribe so you don't miss future episodes where we continue breaking down addiction and recovery in a professional, easy-to-digest way. See you next time.